Ladies and gentlemen, boys and girls, welcome back to my YouTube channel. I'm glad to have you all, even though I can't see you, but I appreciate your presence. So it's story time. I'm going to tell you an amazing story of a heroine woman. Her name is Sarah Carey. In Kenya, we normally pronounce this name as Sarah, but I realize people in the West, or people from the West, pronounce it as Sarah. Anyway, whatever that works for you. So this lady battled with cancer, and she's a cancer survivor. She was experiencing some symptoms like most of us. I'm not saying that she did. You consult your immediate doctor who is right there at your palms. Google. It's not bad to Google. I'm not saying that it's bad to Google. Most of us will want to understand what is causing our ailment, but most of the times you'll diagnose yourself with freaky and strange conditions that will make you even think that you are dying the next day. So I'll advise you to always see a doctor who will help you, or who will carry out some tests that will help you diagnose your symptoms. These symptoms were abdominal cramps, heavy bleeding after sexual intercourse, we call this a postcoital bleeding. Pain during sexual intercourse, we call this a dyspareunia. So she concluded that she had endometriosis because it presents with some of these symptoms. I want you to know that many conditions might have similar symptoms in terms of presentation. So she experienced these symptoms for 6 months until it hit her husband. This is not normal. Things are not okay. As a caring husband, what will you say, or what will you tell her? Honey, we have to see a doctor. What exactly is endometriosis? Let's a little bit look at the anatomy of the uterus. The uterus has 3 layers. These are perimetrium. From the word peri, you can tell this is the outer layer covered with a sheath, just like pericardium. Then the second layer is myometrium. This is the muscular layer made of smooth muscles that normally holds a baby during pregnancy or during the process of conception. And lastly, we have endometrium, that is made of mucous membrane. This layer normally thickens during menstrual cycle for possible implantation of the embryo. If a person doesn't get pregnant, this is for ladies. Men don't have a uterus. It normally sheds itself. That's why ladies normally experience bleeding during their menstrual cycle or during their menstrual period. Now, when we talk about endometriosis, the endometrial layer or the endometrial lining of the uterus grows in other places. In short, functioning endometrial cells are implanted elsewhere within the pelvis outside the uterine cavity. These places may be your ovaries, your fallopian tube, and symptoms normally depend with the site of implantation, and normally present with a classical triad of symptoms. Triad means 3. These symptoms are dysmenorrhea. These are painful menstruations accompanied with abdominal cramps. Dyspareunia, we had talked about this, is pain during sexual intercourse or pain during sex. And then lastly, we have dysuria. This is pain during urination. Other symptoms may include pain during defecation and also infertility. Most of you might have heard of this test, or some of you have had it done on you. Pap smear, otherwise known as cervical screening. So this is a test that is used to check the health of a female cervix. So she hadn't had one in 7 years. Why? She had delivered twins and she had tears. Tears can occur within the vagina, the vulva, or the labia, but specifically she had 3rd-degree tears. This is a tear that extends to the perineum. The perineum is where the muscles that control your anus are located. And those of you who have had an injury or a tear to that place, you will understand that that place is very painful and is difficult to heal. To add on that, this is not the cleanest part of your body. There's a risk of developing sepsis. A pap smear is normally invasive, so remembering the pain that she had undergone through when she was delivering those twins and the perineal tears, you can now understand why she was afraid to go for a pap smear. The fear of pain. She was booked into a pap smear a week later after the husband had suggested that they should go and see a doctor because she was overdue for screening. During this procedure, a doctor or a nurse will use a small brush that will be used to gently remove some cells from the surface of a cervix. So a speculum may also be used. This is a tubular tool that is normally used to help to provide good visualization of the cervix, so that a small sample of your cervical cells can be taken for biopsy. 2 weeks later, after the screening, she got a letter that said that she had abnormal cells after the biopsy, and she was asked to go to the hospital immediately along with someone. Right there, she knew that something was definitely not okay. She definitely knew that she wasn't going to expect good news. To confirm her fears, she was diagnosed with cervical cancer stage 2B, which means that it had spread to nearby organs. Don't worry, there's a video I'm making about cancer. Maybe I'll drop it before this video or after this video, so it will help you understand the stages of cancer. Sarah Carey, our heroine of the story, underwent 11 weeks of her radiotherapy from Monday to Friday, and also underwent 11 weeks of her chemotherapy on Mondays. So radiotherapy uses radiations to kill local cancer cells, and chemotherapy uses chemicals to kill cancer that is already in the system. So I'll expound more on this on my cancer video. She also underwent 3 bouts of brachytherapy, which is also a form of radiation therapy. Before her treatment began, she underwent an operation to remove her ovaries so that she didn't go into early menopause. She lost so much weight. These are side effects of her cancer treatment, and she was also left inclined on a wheelchair. So ladies and gentlemen, after her treatment cycle was completed, Sarah had to visit the hospital after every 6 months for scans, blood tests, and internal tests. Her treatment was successful, and she calls herself a lucky lady. What a strong lady. She never gave up. She fought this thing. Where a round of applause. Sarah, wherever you are, congratulations on fighting this thing and never giving up. Soon she will be a cancer-free patient. This story was published a week ago from when I'm shooting this video. And right now she's back at work, but she's still experiencing some side effects triggered by radiation. And also she has to use her dilators at the areas where radiation therapy was done, as it sort of shrinks the vagina. And also she's still battling IBS, irritable bowel syndrome. Not that there's a difference between IBD and IBS, but we'll look into this in another video. So Sarah is keen to advise women or ladies to keep up with the regular screening. She said that most women normally fear smear tests because they are invasive. That's why they avoid it or shun from it. It only takes a few minutes. You may feel a little bit uncomfortable, but it's worth it. It's easier to get a cervical screening than undergoing treatment with all the after effects of it. Smear tests are mostly free, and it only takes approximately 5 minutes and you're done. So ladies and gentlemen, boys and girls, that's the beautiful story of Sarah Carey. And if you like it, please share it with all ladies that you know to create awareness. Tell me in the comment section if you like this kind of stories. I'll do more of them. Thank you for listening. Bye bye, and let me meet you in the next one.